Hey, good day, arthritis warriors. This is Dr. Joff, and today we are going to talk about the most common reasons for a hip replacement. So, I hope this is valuable to you. I'm going to show you some slides which we actually used from a very recent presentation. We did a workshop in a local hospital about total hip replacements, and we had surgeons, orthopedic surgeons from Manila, from Visayas, and even Mindanao. So hope this is helpful to you and share it with someone who is interested. So the first common indication for a hip replacement is hip fractures. This is an actual patient taken with permission. She fell in her own home and was immediately brought to the hospital where we did a direct anterior hip replacement. This means no muscles are cut, and when no muscles are cut, patients are up faster with less pain and they can be discharged sometimes as early as 24 hours or even outpatient. In other countries, it's now being done as an outpatient procedure. This is a patient done with the same procedure. And the next indication is avascular necrosis or AVN. This means the bone is actually dying or bone death. Now, if the bone dies, what happens is initially nothing. You don't feel much except a sharp pain, but there's nothing wrong on x-rays. We actually get MRIs. Later, when it's severe, we now see it on the x-ray. The bone is damaged. The patients start to have a limp. And these patients are typically very, very young, and they already have severe arthritis. So you will notice the limp in patients with AVN later having arthritis. This is before surgery, and after surgery you can notice that he's now walking normally after another direct anterior hip replacement. Again, no muscles are cut. And the next thing we see is arthritis. Usually in elderly patients, this is a normal joint compared to a joint with arthritis that is severe. This is severe osteoarthritis happening through time. It's a wear and tear thing. And patients, again, usually with a limp or a cane, we do a total hip replacement, removing the ball and the socket. And once we remove the ball and the socket, we put a new cup, a new socket, and the new ball part or the stem. The patients with direct anterior hip replacement, sometimes they don't even use their crutches or walker because they aren't in much pain. And lastly, for failed surgeries, we sometimes have dislocations or failed or non-unions. We do again hip replacements. So this is another patient who did have a failed surgery initially, but we revised it and she's now walking. Hope this was helpful to everyone. Share this with your friends and patients who are interested in hip replacements.